Hi, this is Farouk Alemi, and I'd like to talk to you about the needs assessment and doing information system requirements. The secret to successful information system is to design something that meets the information needs of the end user. But for many reasons, this has not been easy to do. Let us start with some ways that I do not think you should do information needs assessment, and that nevertheless is commonly being done. One way is to analyze organizational tasks and see how information is used in these tasks, then plan an information system around these needs. This approach often fails because what we do in 6 months or a year from now could be very different than what we are doing now. What we will do is not the same as what we are currently doing. You can also not do any soul searching and just do as other healthcare providers are doing. Copy others. After all, what could be so different in an electronic health record? This approach also is not recommended because it fails to take strategic and competitive advantage from the investment in the electronic health record. It relegates the electronic health record to a commodity that cannot be used to distinguish your practice. You can also ask users, but users typically have a limited view, do not know the technology that is emerging, cannot anticipate their own needs, may not be there when the system is ready, and ask for far more things that they need. They give long lists of what they want, but use very little of the information. Current approaches of information needs assessments have been failing us. You often hear about information systems that do not meet the needs of the client. The common complaint seems to be that the right information is presented too late, or the data collected is not related to the decision that needs to be made, so the system goes unused. Systems that do not meet our needs present the wrong information or present it at the wrong time. Don't you want to reach out in the past and shake up the person who designed the system and tell him or her how frustrating it is to use it? That person, of course, is you. As a manager, you are responsible to make sure that the system you have purchased fits the need of the organization. Why is it so hard to design systems that meet our needs? No one sets out to fail. Clearly, the person who designed the current system wanted to do something that helps, but why did he fail? Perhaps it was not planned to be used by the end users that are currently using it. Systems are organized for organizations and not individuals. Individuals change. Systems have to continue to work. Systems are typically designed many years ago when technology and organization missions were very different. Data collection analysis is not cheap. The data that's collected quickly becomes what the organization excels in. The data not collected is often ignored. The cost of collecting all necessary data is prohibitive, not only in the data collection time, but also in what happens to the organization when it has no focus, when it looks at all information. Choices have to be made to reduce cost and to help organization focus. Individual needs change over time. What the physician was planning to use is often not what they actually use. People say they want things but fail to use them. We often buy things on a whim and are stuck with them for years to come. The solution is to move away from what people say they want today and focus on what they will need tomorrow. Here is a way to accomplish this. The first step is to focus on the future and anticipate the decisions that will be made after the electronic health record is implemented. Some of these decisions are repetitive and similar to what the clinic decides about right now. Other decisions are unique and emerging. Whether repetitive or emerging, the focus should be on decisions, not tasks. Tasks are repetitive operations we do. Decisions are points in the task where we have alternative choices. This is what you have to focus on. What are the clinical and managerial choices that we will face in a year or so? For each decision, then you list the information that's needed. What will make us choose one alternative over another? Will a particular lab test added to standing orders really make a difference in the treatment decisions, or should this be ordered separately? The key is that we are not saying that the information is wanted, but it's needed for the choices that we have to make in the coming years. The third step is to collate the information needed across various decisions and set priorities for these information sets. Usually the priorities are set by asking a group of experts to rate on a scale from, let's say, 1 to 7, 7 being the most important. The fourth step is to focus on information judged to be important in different decisions. Here we calculate averages and ranges, and based on that decide whether to collect the information quickly or whether to wait and collect it later. As an example, let us look at how we designed a system for mental health commissioners. A Delphi process was used to identify the future upcoming decisions. A Delphi process is a form of crowdsourcing where a large group of experts identify what might occur in 1 or 2 years from now. In this process, we identified a large number of decisions, including the following 3. How to reimburse the growing number of paraprofessionals who treat mental health clients. What educational programs or policies should the state adopt to upgrade knowledge of mental illness among primary care physicians? And third, many chronically mentally ill patients live in nursing homes that cannot provide adequate care. What policies should the state adopt to improve care for these patients? Here are 2 out of 69 items that were identified as pieces of information necessary for one or another of the decisions that the commissioners had to make. For example, item number 5 was how expensive is it to provide services that fully meet clients' needs. For each item, we asked the commissioners and an expert panel to rate the importance of different pieces of information. We then calculated average and range, and based on the values of the average and range, assigned the information item to different categories. Note that something that is persistently rated as important will have a high average score and a low range. Here is a piece of information judged to be consistently important across different decisions based on the averages and ranges. Here are items that were judged to need rapid data collection. They were considered relatively important in a large number of decisions. Here are some items that were judged to need periodic data collection and did not need to be part of the electronic health record. They still needed to be collected, but not as part of the electronic system, perhaps as separate papers or occasional surveys and so on. Here are examples of information items that the group decided to ignore, at least until more funding was available. These seem like important information items, but they weren't crucial for the decisions that were coming up. The take-home lesson should be simple. For needs assessment, focus on the future decisions and then see what information are needed in these decisions.